Good morning, everyone. My name is Maya Luria, and today we are talking all about our healthcare directives and how to take charge of your health. I have Carly Perez here with me today. She is a nurse practitioner with our TMC Goal Concordant Care team. Carly, what is the Goal Concordant Care?
Yeah, good question. Everybody asks, what is that? And I had to Google it myself when they approached me about it. But Goal Concordant Care is patient directed care, um, evidenced by the best clinical benefit. So, making sure that we are providing care that aligns with your goals and values, particularly those who are chronically or seriously ill, or those nearing end of life.
Great. Well, thank you. Thank you for sharing that. I know that, it's a different term than people might be used to hearing. And so I think it's important to be able to share that. You have put together a wonderful presentation this morning. I'm going to go ahead and put it up. You may be watching us today on either our YouTube channel or one of our Facebook pages. If you have a question for Carly, please put them in the comments and we'll have her address those after the presentation. So I'm going to go ahead and hand the floor over to you, Carly.
Right. Thank you, Maya. My name is Carly Perez. I know some of you may have been looking forward to LaDawn Sawyer doing this presentation today, so I apologize that she is not here, but I am filling in for her. So my name is Carly Perez. Thank you, Maya, for the introduction. I have been a nurse for 17 years. I have various areas of background, mostly critical care and then end of life. And I worked at TMC or I still work for TMC for about 10 years and mostly at Pevy's House or TMC Home Hospice. So I'm working on the Goal Concordant Care team. And this is called Taking Charge of Your Health in the Hospital and Beyond. So in the emergency department, we want to discuss what to bring, what to say, and how to be prepared. So first and foremost, we want to make sure that if you make a trip to the emergency department, if it's possible to have someone with you, an advocate, a family friend, anybody who can speak on your behalf and is sort of those extra set of ears. So I realized during COVID, this was much more challenging because we weren't allowing other visitors in, but that's opened back up since COVID has gotten better. So if you do make a trip, bring somebody with you. Also, we recommend bringing a list of medications, your most current medications, or you can even bring medication bottles. You want to have an ID card, your insurance card, and any advance directives that you may have. It's essential that you know the names of the medications and if you took them during the day. ED is going to want to have an accurate medication list, and they will probably ask you numerous times. We give medications that may interact with the medications that you've taken, so it's important that we know what you've taken that day. Another thing that happens frequently is patients will say, I don't have high blood pressure, but they're taking 3 medications for high blood pressure. So even if it's controlled, if you're taking medication for it, it means you have it. All right. Urgent care versus the emergency department. So we also put in here our primary care physician. You want to use your primary care physician when it's not necessarily urgent. You're there to see them for overall wellness, management of chronic diseases, your vaccinations. And the urgent care is maybe you need to be seen slightly more urgently. And if you have to wait a week or so, maybe a month to get with your primary care physician, maybe you have a rash, pink eye, those kind of things, you want to visit your urgent care. And then your emergency care is for life-threatening conditions, confusion, chest pain, severe abdominal pain, allergic reactions, snake bites, strokes, trauma. We don't want to back up our emergency services for things that might be taken care of at the urgent care or the primary care physician. So again, what to bring? Bring that current medication list that we spoke about, the advocate, your advanced directives, which we'll talk about here a little bit more in depth shortly, your medical problems, and your medical history. What to say to the emergency department. So what is bringing you there that day? What is the problem that brought you to the emergency department, and who your medical power of attorney is? You want to make sure the medical care team knows. So in the event that you are unable to speak for yourself, we can promptly and quickly get a hold of someone to speak on your behalf. You want to succinctly tell the staff why you're there. We probably don't want to know about your tetanus shot from 60 years ago, unless you happen to be cut by something on the fence and you haven't had a tetanus shot, then we want to know. But otherwise, we want you to stick to exactly what brought you there so we can help you quickly. There might be a lot of wait time in the emergency department, and that's because we have to do what we call triage. And we have to take care of the patients that are the most critically ill. So sometimes they are sicker than others, and so they warrant our attention first. So we know it's frustrating, and we're sorry that there's typically long waits in the emergency department. So we recommend that you bring stuff if it's possible for comfort. So bring your your cell phone charger, maybe a good book, some headphones or earplugs, because it's also very noisy in the emergency department. If you don't understand something, ask. Before you leave, ask the provider your symptoms that would cause you to return to the emergency department. This is really important because by the time you get home, these questions will start popping in your head, and then you'll be unsure. So while you're there, write your questions down and ask before you leave. Healthcare directives. Prehospital medical directive, you may have heard that as called a do not resuscitate form, or a DNR form, or an allow natural death. Your healthcare power of attorney, your living will, your mental healthcare power of attorney, and something relatively new to Arizona is a POST form, physician order for life-sustaining treatment. So you want to bring these forms with you. A do not resuscitate. Some people decide that they do not want CPR or to be placed on a ventilator, or they don't want to be shocked like you see in the movies. So you have to bring this form, and it must be on orange paper in order for it to be valid. So if you bring a white copy, they cannot accept it, and they will do all resuscitative measures. So make sure that you have multiple copies in orange color. Have one on your fridge, so if the emergency department comes to your home, they can easily find it and take it with you. Have a copy in your wallet, and always make sure your primary care has a copy as well. Your healthcare power of attorney. This is in the event you are no longer able to make decisions on your own. This is the person that you appoint to make decisions on your behalf. So if you don't have this in place, it will go by Arizona's surrogacy laws. So if you're married, it would go to your spouse, and then your children, your siblings, so on and so forth. So you may be married, but maybe you don't want that person to be your medical healthcare power of attorney. So if you don't want them, you need to specify who it is. I hear frequently people tell me, well, oh, it's fine, my husband knows. But your spouse may be incapacitated as well if, for instance, you're both in a car accident. So you want to make sure that you have a primary and a secondary medical power of attorney in writing. The living will form allows you to fill out types of medical treatments that you want or you don't want during end of life. So it goes kind of hand in hand with your healthcare power of attorney, and you should discuss these wishes with your MPOA. Your mental health power of attorney. This tends to be very scary when people hear mental health. These are really good forms in the event that your loved one has dementia or maybe a psychiatric behavioral health. This form will allow you to admit somebody to a level 1 facility. So sometimes people with dementia, they have behavioral problems that they can't help, and they need their medications checked and maybe redone, and spend a little time in a facility to get them sort of evened out so that they can get home. If you don't have this form, you cannot admit them to these facilities, and it is very challenging to get guardianship, and you have to go through courts, and it's very extensive. So this is different from the medical healthcare power of attorney. In the state of Arizona, you have to have both, one or the other. Sometimes they're on the same form. Other times they are on separate forms. So make sure that you're filled out both. Now your POST, your physician order for life-sustaining treatment. This is actually a portable medical doctor's order, and it can go from state lines, across state lines, and it goes a little bit more in depth about maybe CPR, a feeding tube, how you want to be treated. This is for elderly, frail patients that want some medical care, but maybe not everything. So you sign it with your primary care provider, you make sure they have a copy, and you make sure the hospital has a copy as well. What happens when you don't have your documents? Everything happens. So we as medical professionals will do everything possible to keep you alive. So that means if you stop breathing, we will put you on a ventilator. If your heart stops, we're going to do CPR, chest compressions. We're going to shock your heart. We'll give you medications to try to restart your heart. And we will put lots of IV lines in, catheters, you name it, you'll get it. So if that's something you don't want, it's important that that's in writing so we respect your wishes. And just something to think about CPR, especially those who are frail. Currently, research suggests that healthy people, only about 10% of them who receive CPR will survive enough to recover to leave the hospital. So that's someone like me who's relatively young and healthy. I have about a 10% chance of recovering enough to leave the hospital. Those who are chronically ill have about 5% chance of leaving the hospital after receiving CPR. And it's important to understand that their quality of life may be very different from before they arrived in the hospital. So really think about if that's something you want to go through. Does your loved ones know your wishes? So 90% of people say that it's important to talk to their loved ones about end-of-life decisions, but 27% have actually done so. And then 60% say making sure that families are not burdened is extremely important, but 56 of those people have not communicated that information with their loved ones. And then here, 82% of people say that putting their wishes in writing is important, but only 23 have actually done it. So tomorrow is National Healthcare Decisions Day. I encourage everybody who doesn't have their advanced directives to get online, Google that. Arizona has their own website with all the information so that you can fill them out. They do not need to be notarized, only witnessed by a non-family member or a medical professional who is not directly taking care of you. So I really encourage everybody to do that this week and submit them to Health Current, which is our HIE platform or Health Information Exchange. If you upload it to Health Current, healthcare providers can access your wishes easier and quickly. So why is it important? It's your life, it's your plan, and it's your choice. Not everybody wants the same thing, and that's okay. But if we don't know, you get everything. So it's the right thing to do for your family. To leave them with decisions that they aren't sure about can be very traumatic. So you want to make sure your family knows so that they can speak on your behalf. And it gives you control. Something that I'm sure we all know as we become more ill, we lose more and more control. So keep it. Now, there's a picture of LaDawn for those of you who knew her. This is a pretty common response that we hear. Why won't Dad do his advanced directives? Oh, he's like that. You know, you and Steph will figure it out. You're smart. Steph, do you know what Dad wants at end of life? Nope, not a clue. But you know, he's got a strong faith, and God will take care of it, or he'll go to heaven. Dad, you got to tell us about your wishes for treatment for end of life. No one knows what you want. Let's talk about it in the spring, he says, when I come to Tucson. So a lot of people will push this conversation aside. It's a challenging conversation. But once you get in there and you really put it in writing, it becomes easier each time. And then there's just a cute little funny from It's Always About You. So preparing for your actual stay after you have gone to the emergency department and you are being admitted to the hospital. Again, bring your reading material, your phone charger, and all your medications. Make sure your primary care doctor stays informed during your stay. Get written documentation and give them a copy. Again, ask any and all questions. Use the nurse call button if you're in pain. If you need anything, make sure that call button is nearby. And then make sure the staff know how to reach your family or your healthcare proxy. If you don't already have the healthcare proxy or your medical healthcare power of attorney, create one after you leave this session. I challenge everybody on here who doesn't have an advance directive to fill it out. Can't say it enough. Always ask questions. So one of the most important things you can do to advocate for yourself during your stay is to ask, what is the reason for this admission? What are the goals? They should address what medications you'll take. So ask about tests, procedures, why they're being done, what appointments you'll need. And don't be afraid to record the answers or write them down. Because you're under a lot of stress, you don't feel good, and you don't remember everything you hear every day anyway. So when you're already overwhelmed, it's easy to forget. Ask about acronyms. We as healthcare professionals, I already did it to you guys once. I said MPOA. We have 1,000,001 acronyms. So you'll hear us say, well, we're going to take them to the OR, and then they'll go to the PACU, and then after that, they'll go to the ICU. And sometimes we forget that people aren't aware of what those mean. So if you hear UTI is another one, that's a urinary tract infection. So if you don't know what the acronym is, ask. Infections. So we all are at risk for infections, and especially in the hospital. So prevention is the best, and how we do that is hand washing. I'm sure you guys all know the push after COVID of how important it is to wash our hands, not touch our face. So make sure that anybody who enters your room is using soap and water or hand sanitizer. If you have catheters, if you have IVs, ask every day, are these necessary? They have them in place usually for a reason, but they are also they're a place where bacteria can enter the body very easily. So less is more a lot of times if possible. So ask, is this necessary? Can we take this out today? Protect yourself, again, by asking those questions. So clean your own hands, ask your family members to do the same, and don't be afraid to ask a healthcare provider. Even the physician, if they walk in, say, I didn't see you clean your hands when you came in. Would you mind cleaning them again? Or I'm worried about spreading germs. Will you please clean your hands before you start my treatment? And again, ask your loved ones. I saw you clean your hands when you arrived some time ago, but would you mind cleaning them again? So if they refuse, then that's a big problem. It's your right. You ask people to wash their hands. Keep moving. If you're able, while you're in the hospital, one of the biggest complications of being in the hospital is becoming weak and losing strength, especially for the aging adults. So keep moving. Unless you're unable to do so, that means get up and walk, get up and down to the chair, take a stroll. So for every day that you spend in the bed, it will require about 5 days of movement recovery after you leave the hospital. So continue moving, needing that extra recovery time. Your thighs, the front of your thighs, is where you lose the strength first. And you can literally lose strength in a day. So don't be afraid. Range of motion, keep moving. Get on board with your discharge plan. So, you and your advocate should ask about your discharge plan when you're getting ready to be released from the hospital. This includes follow-up visits, primary care specialist, who your point of contact is, appointments, tests, and be sure to get the discharge summary, get extra copies for your primary care. And again, ask about those new symptoms. What should I look out for? So here are some questions for the general public. This was an initiative done by the AHRQ. So these are some questions that you can ask when you're in the hospital. What's this test for? When do I get the results? How do you spell the name of that drug? Are there any side effects? So stay off of Google. I can't tell you how many times I have patients say, well, I can't take this medication. I Googled it. So Google lists everything. And if you look at it, you will get every single side effect possible because it's Google. It's not a reputable place to look up medication side effects. So ask your healthcare provider, ask your pharmacist, but don't Google for those side effects. Do they interact with medications that I'm already taking? So this is a good question because sometimes we give you medications that have a low risk of interaction, but the physician has to outweigh the risks and benefits. So it might interact, but if it's a very small problem, they might still give it to you. So you want to ask about interactions, but again, not from Google. Are there any alternatives? What are some possible complications? Which hospital is best for my needs? And how many times have you done this procedure? I don't think any of us want to have open heart surgery from somebody when it's their first surgery. You can download this app. It's called the Question Builder app. It has all those questions we just discussed. You just download it, and then when you're in the hospital, you can open it up and it'll help remind you of the questions. You can take photos of your insurance card, your pill bottles. You can be prepared for any medical encounter. So it's really neat. I'll leave this up for a second, or we can always go back to it. You can use your cell phone on the screen for the QR code. This is a cute little funny here. You can see where did I leave that pouch? And she's got the urine bag. So pay attention to your surroundings in your room. Self-advocacy takeaway number 1. So if any member of the medical staff says something to you you don't understand, again, ask for an exclamation. It's really useful to repeat back what you have heard, and it's also useful for the nurses and physicians because then we know you understand when you can repeat it back. Number 2, although you sacrifice your own autonomy, because you're vulnerable, take control of what you can. So again, get those advanced directives. Make sure each person caring for you washes their hands. Make sure you know their role and any purpose or for any tests or procedures. And number 3, there's always a lot of resources out there that sometimes we don't tap into. So be sure to ask. So ask for a liaison, a patient advocate, maybe a patient satisfaction team, somebody who can guide you, a caseworker, social worker, even a spiritual visit, a pain consult, or a nutritionist, maybe physical therapy. These are all things, if you have concern, you can ask about, and we can get you in touch with someone. Another consult to think about that I will throw out there is a palliative consult. So usually when people hear the word palliative, they panic and they automatically assume that means end of life or hospice. But palliative care is actually not necessarily end of life. It is really called symptom management. So they are specialists in making people comfortable, whether you're chronically long-term illness or achronic long-term illness. They can help sort of make sure that they look at the bigger picture, so to speak, to make sure that you're comfortable. They're very crafty in how they make people comfortable, but again, it doesn't necessarily mean end of life or hospice. Number 4, communication is probably the biggest challenge in the hospital. We have a lot of emotions when we don't feel well. We're scared, maybe guilty, we're confused, we're angry. And healthcare workers are trained to recognize that this is a tough experience. So share your emotions, because then we know how to better help you. So take charge of your own healthcare. That's my spiel. I'd love to hear if you all have any questions.
Thank you so much, Carly. So I do have a couple of questions that came in, and I think we'll probably share your PowerPoint afterwards, because, you know, just it'd be great if people can get that app that you had shared as well. So we'll send that out.
Okay.
Do you know or have any tips for a family that maybe has multiple kids, and one child is upset because the other child was named, being listed as their proxy, you know, on there as a POA? What, you know, any tips for somebody that might be going through that, or they're just not sure how to maybe make that decision?
Yeah, that's great. So I actually personally just went through that. I have my in-laws living with us, and so we had to go through, and they have numerous children. So it is it's a challenging conversation. It's all about communication, sitting your family down, letting them know that you love all of them. But this is your need, and this is what you feel comfortable with. And, just communicating all of that. Once people understand the why as to why you've made a decision, they're more open to hearing it. So again, it could just be something really simple like, this one lives near me, and so I think it's a good idea to have them. What will happen if you don't have it in writing and it goes to surrogacy and you have children? It has to be a majority decision by the children. So if you have 5 and 4 of them agree and 1 of them doesn't, they're going to go with the majority of children. Most people think that it's the eldest child. It is not the eldest child. It is the majority. So communicate, bring them with you to your primary care, your wellness check. Ask for a visit with your primary care to have the discussion. Sometimes they can be that mediator between the two.
Great, thank you. And how difficult is it? We had a question come in just asking, how difficult is it to change your POA once you've selected somebody?
I love that. Great question. It's very simple. It is literally tearing it up. So that's why you want to know who has your copies. So it's probably good to keep it in a file of where your copies are. They are not permanent, so you can update them. If we had, let's say the hospital had 2 advanced directives, your old one and your current one, they are going to take the one with the most current date. So just make sure that everybody gets an uploaded copy. If you change them, destroy the others.
Okay. And I know, we've talked about this quite a bit over at TMC for Seniors. Oftentimes people put those directives in the safe. And nobody knows about them. So, you want to make sure that they are accessible, I guess, is what I'm trying to say, and that people can access them, and that the right people have copies of them. Right. Do you recommend sharing also with your healthcare provider so that they have a copy of those, of your latest advanced directives too?
Absolutely. And there's going to be a big push for those of you that go to TMC1, that we're starting to ask people at every visit, do you have your advanced directives? So yes, make sure your primary care has a copy. Make sure the person you appoint as medical power of attorney has one. If you have the do not resuscitate form, again, have numerous copies. Have one right there at the door. Have one right there on the refrigerator. EMS is trained to look at the fridge. And the medical power of attorney you appoint, make sure they know your wishes, they have a copy, and they know where to get extra copies.
So on the orange form, to what point does that go? Like, how far does that take you? Because I know obviously in your home, but once you hit the hospital doors, where, at what point does that, maybe just explain a little bit more about how far you go with the orange form, because sometimes I think there's definitely some misunderstandings.
There's a lot of confusion that surrounds the DNR. It is strictly for first responders and emergency providers. So when you will hand it either to the ambulance or to the emergency room or your urgent care kind of thing. So that is strictly for first responders and EMS. Once you get into the hospital and you tell them that, then it's the ER physician's job to put it in the chart and say, this is what you want or don't want.
Okay.
And you have to do that every time. So many times I get people who come in and they have told us that they want to be a DNR, and then they come back to the hospital. It starts over every time. It's just like allergies and medications. You have to tell us every single time you do not want to be resuscitated.
Okay, great. Yeah, that's the good tips for how to advocate for yourself or for your family, right? Depending on what their needs are. One more question, just about the mental health care power of attorney. Can you explain a little bit more? I know that we have two forms in the state of Arizona, one for your medical, one for your mental health care power of attorney. So can you maybe explain what is the purpose of having that form in addition to your medical power of attorney?
Yeah, so the mental health is for behavioral health. So again, patients that are suffering from mental illness or patients that perhaps have dementia, Alzheimer's, those kind of disease processes. So they tend to have behavioral issues. And sometimes when you're at home and your loved one has dementia and they get really confused, they can get combative. And so to be able to send them, there's what we call TMC geropsych. In order to be able to put them in a facility to kind of get them all better and fixed for their mental health, you have to have that form. So the medical power of attorney does not include mental health. They are different. You have to have one for each.
And you can choose the same person if you wanted to, but you could have two different people then, one for each of those as well.
Correct.
Okay. If you don't have that form and you needed to be admitted to a level 1 facility, I know that gets a lot more challenging then.
Right. Yeah, they can't admit you to the level 1. They have to go through court systems, which can take months to weeks. Meanwhile, your loved one is agitated and suffering.
Okay. I did want to share also that if you need help completing your advanced directives, we do have a volunteer over at TMC for Seniors. You can give us a call at 324-1960, and we'd be happy to set up an appointment for you. And we have the forms here as well. So whether you're interested in, we've got the 5 wishes, and we also have the Attorney General's packet. So we do have both. That can be completed. One provides a little more detail about your wishes, and it just depends on which form you like to use, right? So I'd like to just be able to share that as well. Carly, I want to thank you so much for being here today and providing all of that information. We will share it, and we hope that everyone will take the opportunity to complete your advanced directives during healthcare, healthcare decisions day, and just making sure that everybody knows what your wishes are. So thanks for being here.
Great. Thank you for having me. I appreciate it.